Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. This is Monday Health Minutes. Did you know that about 20% of children are considered to be dangerously overweight, considered to be obese? That translates to about 14 million children, and it can cause a host of issues for their entire life. So we're talking with Dr. Amos, Michael Amos, about that today, about what childhood obesity is and how can we help this problem. The numbers are startling.
It is, and it is only projected to get worse, which is so difficult to deal with, especially here in West Virginia. We have a large obese population in our adults, and then we're also transcribing it to our children. And so it is very difficult for us to be looking at. When we think about childhood obesity too, there's that fine line of when are they going to maybe grow out of it versus when is it truly going to be a problem. And sometimes it can be just raising the red flag.
And so what should raise? I think a lot of people, like you said, they're going to grow out of it. They haven't hit their growth spurt yet. But it's something that we need to be aware of in all assets, because as you said, it starts when they're young and it can very often continue all the way through adulthood with all the health problems that come with it.
Exactly. And so when we're looking, it's very good to keep up with your regular visits. So your annual visits, they do a lot of different things. In addition to immunizations and looking over your health as a whole, we also get those yearly looks at your weight and your height. And so when we plot those on the graph, there are graphs from the World Health Organizations and the CDC to outline where a child should be on their height and their weight, as well as their BMI. But when we're looking at the height and weight, it's very nice to be able to see, are they proportionate? So if you have a child that is 5'10" and 175 pounds, then they're probably about in the same percentile both ways. But when we think about an obese child, we think maybe they're on the shorter side, maybe the 50th percentile, but their weight is in the 95th or greater percentile. So it's very difficult to watch that in one single time. It makes a lot more sense and can help the families and the patient if you're watching that over time. And so trying to keep up with your yearly visits to keep an eye on that is going to be vitally important.
So if you're falling in that category, what should moms and dads do? What should be our first step with our kids?
So I think that it's going to be realizing that we have a problem. We see that the child is far and above their height potential on where their weight is relative to that. And so we need to make a concerted effort at home to start changing the lifestyle at home as much as we can to facilitate, okay, we're not going to be eating out as much. We're not going to be having as heavy diet in breads and pastas as we are in green leafy vegetables and chicken, steak, things like that to help moderate those risks.
It's sort of a whole family approach then.
Yes, that is one thing that I do talk a lot about. When there is an obese child, we look at the lifestyle of the entire family to help with that.
An opportunity for everyone to get healthier.
Yes.
So let's talk about some of the problems that can result if we just kind of bump along and say it's not that big of a deal.
Yes, and so part of the trend that we talked about earlier with adult obesity becoming more of a problem with our children is adult diseases are now starting to affect children, such as type 2 diabetes. And so we see that as children are becoming more obese, their risk for diabetes is greater. And then I would say that as we look ahead, they will also have a greater risk of heart disease and strokes, heart attacks, as well as multiple complications from diabetes alone.
You can have success though. You can turn it around.
Yes, I have seen a lot of patients that have been successful in maybe not completely becoming a normal BMI, but risk modification to bring their diet into a better state and keep their body healthy has been very successful.
And can medications help as well?
Yes, so that's actually a very interesting new point from the American Academy of Pediatrics, as well as the obesity medicine side of things. We are seeing that medications, as well as if even in severe cases, obesity bariatric surgery for children is becoming something that the Academy is recommending and drugs are being approved for. So it's a very exciting time to help mitigate that risk.
It's time for a conversation if you're concerned for sure with your
Very
provider.
much.
Dr. Amos, thank you so much. Thanks for being here. We'll see you next Monday.